So in-office surgery is just regular surgery, we just do it here in the office. Rather than putting you to sleep and putting your brain to sleep, we just put your hand to sleep. It allows us to do the exact same thing we would do in the surgery center or in the hospital, but we get to do it here in the office. So patients come to me asking about in-office surgery for several different reasons. Usually it's numbness in their fingers or numbness and pain in their hand, sometimes a finger that's catching or locking or triggering, and sometimes it's a bump on the back of the wrist or the front side of the wrist, or even a bump on the tip of the finger. And those patients asking about in-office surgery are pleasantly surprised when we tell them, yes, we can do those surgeries here. So when a patient comes in to be evaluated, they come in, we have x-rays here. If we need to get those, we gather all their medical records ahead of time to make it as easy as possible and as simple as possible for them. They have time with me where we look at their imaging, we look at any test results they've had, and I examine the patient in a very detailed way to help make sure that we make the right diagnosis, and then we come up with a personalized treatment plan for them. So when a patient qualifies for surgery in the office, we set them up with a particular date that works with their schedule. They come in, they can drive themselves to the office. They come into the office, we get them numbed up for the procedure, then we perform the procedure in our sterile procedure room. Once that patient is done, we make sure that they feel all right and they get up and they drive themselves home. So after in-office surgery, the patient can usually take off the dressing or bandage in about 2 to 3 days. After that, they can start taking a regular shower and get back to daily activities as tolerated. Now, depending on the surgery, they'll have more or less discomfort, but it's exactly the same amount of pain that you would experience after having that surgery and being asleep. So the best way for patients to find out if they're candidates for treatment is to come in and get evaluated. There are lots of different questionnaires online that can help a patient identify if they have a certain diagnosis or a certain problem, but really that one-on-one discussion and examination with the surgeon is the absolute best way to find out what they have exactly and if they would benefit from surgery.